Cartilage restoration is an extremely exciting area within sports medicine and orthopedic surgery. Cartilage restoration allows us as surgeons to evaluate a patient's joint, identify a damaged area of cartilage, and treat that cartilage with novel, minimally invasive, and often arthroscopic techniques and restore the joint surface to a functioning joint, thereby improving function and reducing pain. There are many different techniques that are available for us with regard to the field of cartilage restoration. Some of those involve transplanting one's own healthy cartilage cells into an area of damaged cartilage. Other techniques with regard to cartilage transplantation involve taking donor cartilage and putting that into the damaged cartilage area within the patient's knee, shoulder, elbow, or joint that is being treated. In short, cartilage restoration allows us to take damaged cartilage, treat it, and turn it into healthy cartilage, improving the joint function, reducing pain, and getting patients back to doing basically everything that they'd like to be doing.